Hello, my name is Rachel Welch, and I am a nursing student at John Tyler. I'm here to do a bedside assessment. Before entering the room, the first thing I would do is I would check my patient's door to see if she had any kind of flags or precautions that I had to be aware of. She is on standard precautions, so I'm going to enter the room and I'm going to assess the room for any kind of hazards, and I'm going to perform hand hygiene. Then I will introduce myself to the patient. Hi, my name is Rachel, and I'm a student nurse. I'm here to give you a bedside assessment.
Okay.
May I see your wristband?
Sure.
Can you tell me your full name and date of birth?
Sherry Johnson, September 27th, 1964.
Okay, thank you very much. Sherry, on a scale of 0 to 10, 0 being the least and 10 being the most pain you've ever experienced, can you tell me what kind of pain you're in right now?
0.
Okay.
No pain.
Great. Sherry says she's in no pain, and as I'm looking at her face, I'm also seeing that she has no signs of distress. It's appropriate to the situation. Her body is relaxed and comfortable. Her skin is consistent with her genetic heritage. She looks like she's in an appropriate weight for her age and her height. She's well dressed and clean and appropriate to the season. So I'm going to go through with you, Sherry, a couple of tests. First, I'm going to shine a light in your eyes.
Okay.
Sorry. And if you would just look at my nose for me, okay?
Sure.
Okay, and then wash the end of my pen. Okay. Sherry has 3 millimeter dilated eyes. They are equal. They are round, reactive to light and accommodation. So I'm going to ask you to give me a big smile and raise your eyebrows and pucker your face. Stick out your tongue. Okay, wonderful. Sherry has no ptosis, nor does she have any facial droop. So we're going to go through some motor responses. Can you lift up your arms for me? Okay, can you bend at the elbows? Can you touch finger to finger? Finger to thumb, I mean. Can you touch finger to nose? Okay, I'm going to test your strength. So will you grab my fingers and give them a big, strong squeeze? Okay, and will you push on my hands? And now pull. All right, now I'm going to do it with your feet.
All right.
Push on my hands and pull and wiggle your toes. Wonderful. Sherry's motor responses and verbal responses are both intact, and they're equal bilaterally. Her muscle strength is strong in both her upper and lower extremities bilaterally. Sherry, I'm going to test your senses. Can you do me a favor, close your eyes. Every time I touch you, I want you to say now.
Now. Now. Now. Now. Now. Now. Now. Now.
Okay, her senses are fully intact. And okay, you have any problems swallowing?
No.
Okay, I'm going to do a small swallow test with you, if you wouldn't mind sitting up. I'm going to give you 30 milliliters of water. I'm going to ask you to hold it in your mouth. I'm going to tell you to swallow.
Okay.
Okay? So hold the water in your mouth. Give me a big swallow. Okay, and now say after me, Mary had a little lamb.
Mary had a little lamb.
Okay, thank you. Sherry has no problem swallowing. All right, you can go ahead and have a seat back. So as I'm observing, Sherry is not on any kind of supplemental oxygen. She has no intensive spirometer ordered. She is breathing room air. Her breathing is non-labored and relaxed. And at this point, I'm going to listen to her breath sounds. I'm going to listen to it on top of her clothes. Normally, I would listen underneath on the skin surface. All right. So I'm going to listen to it anteriorly. Take a deep breath. And one more. Okay, and again. And another one. All right. And I'm going to get your sides. Deep breath. Deep breath. All right. If you wouldn't mind sitting up for me, Sherry. Deep breath. Another one. Another one. One more. Next side. Okay, wonderful. You can sit back if you'd like.
Okay.
Sherry has no adventitious sounds, and her breath sounds clear bilaterally. So that's very good. All right, so at this point, I'm going to assess your heart. I'm going to listen to your apex for any kind of irregularities. Normally, I would listen for 1 full minute. Her heart rate is regular, S1, S2. Now I'm going to compare her apex to her radial, and there are no deficits noted. Next, I'm going to listen to all of her heart sounds. First with the diaphragm, aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I'm going to turn it over and listen with the bell side. Same points. This time I'm listening for murmurs. I'm listening for abnormalities and bruits. Okay, awesome. Heart sounds good. Okay, so I'm going to have you hold your hands out for me. And at the level of her heart, I'm going to check her capillary refill in her hands. And I'm seeing that she has a less than 3-second refill, so that's very good. I'm going to check her legs for any edema, and she looks good. I'm going to check her dorsalis pedis pulse. It is equal to plus bilaterally. And I'm going to check her her post-tibial pulse, and it's also equal to plus bilaterally. Okay. I'm seeing that Sherry is not on any IVs. If she were on IV, I would assess the fluid and the rate at which it was being delivered, and I would compare it against the MAR. And I would also assess the IV site for any infection, any redness or swelling, anything that looked abnormal. So as I've been looking over Sherry, I have noticed that she hasn't had any kind of skin breakdown. I am going to check under her backside, pressure point that I hadn't had an opportunity to see if there's any kind of swelling, redness, or any kind of heat. So Sherry, if you wouldn't mind just turning this way for me, and I'm just going to check to make sure she doesn't have any kind of skin breakdown, and then if you wouldn't mind turning the other way. Okay, you look good. Thank you very much. So she has no problems with friction or shearing. She doesn't have any risk for breakdown. She has fully intact senses. She is mobile, no incontinence. She has excellent nutrition. She scores very high on the Braden scale, so that's not a concern for us today. So next I'm going to check her abdomen. I would put her in a supine position to check her abdomen. So if you wouldn't mind, I'm going to just pull your blanket down. I'm going to ask you to get in a supine position. Okay, so I'm going to just, get comfortable, you're good. I'm going to just check her stomach for the contour, which is flat, symmetrical. Her umbilicus is inverted. I'm not seeing any signs of distension. I'm going to listen to her bowel sounds, and I'm going to listen in all 4 quadrants, and I'm listening for presence of bowel sounds, which is what we want. No bruits, so that's good. I'm seeing that she doesn't have any kind of tubes, lesions, or dressings. Sherry, I'm going to give you a little palpation. Do you have any tenderness?
No.
Okay, so I'm just going to lightly palpate, and I'm going to be feeling for masses, tightness, distension, any kind of abnormalities. She feels pretty good. There's nothing unusual, and it's soft. So I'm just going to cover you up here, and if you want a pillow back to sit back up, you're welcome to do that.
All right, great. Okay.
Wonderful. Okay. So Sherry, in the past 24 hours, have you been able to tolerate solid and liquid foods?
Yes.
Solids
Mm-hmm.
and liquids?
Mm-hmm.
Okay, great. Have you been able to pass gas, and have you had bowel movements?
Mm-hmm.
When was your
Yes.
last bowel movement?
This morning.
Are you pretty regular?
Yeah, once a day.
Great.
Mm-hmm.
And your urine, can you describe the color for me?
Yeah, it's clear and like a light yellow.
Okay, good. Does it have any kind of odor to it?
No. Mm-hmm.
Okay. Do you, can you give me like a guesstimate on how much you probably urinate a day?
Well, it probably depends really on how much I drank.
Okay, so what did you
It's
say?
pretty even.
Pretty even?
Mm-hmm.
So even to intake to output, so that's very good. Wonderful. All right, so Sherry is not on bed rest, but if she was, I would want to put her head of her bed at a 30-degree angle. I would want to check her for any kind of friction or shearing, and I would help her with any kind of assistance if she needed assistance moving to a chair, if that was indicated. Do you have any problems walking?
No. Mm-mm.
Are you in need of ambulatory devices such as walkers?
No.
Anything like that? So
No.
she is not in need of any kind of ambulatory device or equipment. And also I'm going to want to check her legs for any SEDs, TEDs, or any kind of foot pumps. And I would want to assess her for a fall risk, which she is not high for a fall risk. She's very low. She is under 60. She is completely mobile. She is continent, never had any problems with incontinence, never had any problems with falls. She's fully cognitive. She's not on any tether devices, and she doesn't take any kind of medications that would indicate that would have a problem with falling. So to finish my assessment, I would want to put her bed into a lowest position possible. I would want to put side rails up. I would want to make sure she had a call bell, and I would make sure she had an alarm if it was necessary, and document my findings. So thank you very much.